Hi, my name is Angie Caton. I'm a nurse at Northeast Georgia Medical Center.
I'm Dr. Robert Baskin. I'm an ear, nose, and throat physician affiliated with Northeast Georgia Medical Center. We decided to do a project related to head and neck cancer screening. We found that at our facility, primarily when patients are diagnosed, it's at a higher stage, stage 3 and 4. And as we know, when patients are diagnosed at earlier stages, their prognosis and outcomes are improved, and therefore we wanted to work with our community in order to try to facilitate earlier diagnosis of head and neck cancer. And we decided to do so through self-screening and trying to educate the high-risk populations on the process of self-screening for oral cavity cancer. So we decided to construct a project in order to facilitate that goal.
And we used the PDSA quality tool to guide our project. First of all, I recruited Dr. Baskin and to help with this project, and we defined a target population. We found resources, secured funding, and secured dates, and a process for follow-up. The 2021 screening was more of a learning type of screening, and then we took our lessons learned and applied it to 2022. So for 2021, we used hospital employees, and we had a web-based appointment system, and it was held in May of 2021, about 4 hours. In 2022, we held it for about 3 hours. We use Skype and Zoom, and we provide one-on-one education with each participant, either in person or like with the employee screening in 2021, we mailed things to them. In 2021, we screened 13 targeted employee hospital employees. Our direct costs were very, very small, as you can see, and we used Skype. In 2021, we screened 8 of a target population that were low income and mostly tobacco users receiving care in the outpatient setting. Our direct costs were only $180, and again, our in-kind hours are mostly Dr. Baskin and I's time. And we found no abnormalities, and we used the Zoom platform. We had some difficulties, again, with both Skype and Zoom platforms, but we did use a laptop for the second screening with earphones. So, the patient was there receiving an IV antibiotic, had talked to them before. We put the laptop in front of them, already logged in, gave them earphones, and pulled the curtain, and Dr. Baskin and the participant engaged in a screening. And then after it was done, I went back and did more education and gave them some resources, which included a mirror, a flashlight, and a screening guide. And then I think that is, we needed more time for screenings. It's still, this is a transfer back and forth from patient to patient. And then we did reach a lot of the target demographics, but we'd like to do a little bit better with some of the at-risk populations that Dr. Baskin's going to talk a little bit about now.
Yeah, so we have a indigent care clinic that's associated with our medical center that we think that we may want to target. There's also other indigent clinics in our surrounding areas within about a 30 to hour minute drive from here that we may attempt to coordinate with for further screening education. And so we feel like that this can be expounded upon to reach others in our community.
And then I will work toward obtaining funding for incentives. So with our at-risk populations, incentives seem to work. And we're talking small incentives like $10, a $10 gift card. And with the gas costs now, maybe, a gas card might be a great incentive for our patients. You'll see a list of our references, and at the bottom is also my email. If you have any questions, we'd be glad to talk to you more about it. Thank you for listening.